Epinephrine for anaphylaxis and medical directives. Epinephrine auto-injection kits are commercially available to deliver epinephrine into muscle for emergency use for anaphylaxis and severe allergic reactions. After delivery into the muscle, the medication is rapidly circulated throughout the body to combat any symptoms of anaphylaxis. The Allergen pen will be utilized by Barry Fire. This auto-injector device delivers audible prompts on how to administer.
5, 4, 3, 2, 1. Injection complete.
There are adult and pediatric units. Indications and usage. Epinephrine is indicated in an emergency treatment for anaphylaxis or severe allergic reactions. These can be caused by insect bites, insect stings, foods, allergies, other allergens, no obvious causes, exercise-induced. Such reactions can occur within seconds or minutes following exposure to a stimulus. The epinephrine auto-injector is designed as an emergency supportive therapy only, and if not a replacement or substitute for immediate life-threatening or hospital care. There are no absolute contraindications to the use of epinephrine in life-threatening emergencies such as anaphylaxis. Epinephrine should not be used in patients with a severe allergic reaction with no evidence of shock who are greater than 35 years of age, have a history of a cardiac condition, or have a systolic blood pressure of 180. The pharmacology. Epinephrine is a naturally occurring stress hormone released by the body that counteracts the low blood pressure, facial and throat swelling, and shortness of breath that anaphylaxis causes. Epinephrine has a rapid onset and a short duration of action. Warnings. Epinephrine is light and temperature sensitive, and it should be stored in the device and packaging provided. If a vehicle is to be stored outdoors in freezing temperatures for greater than 1 hour, remove the auto-injectors from the vehicle. The auto-injector should only be injected into the thigh. Do not inject into the buttocks. Chest pain or angina may be induced by epinephrine in patients with a heart disease. Minor side effects of epinephrine include the following: palpitations, respiratory difficulty, pallor, dizziness, weakness, tremor, headaches, throbbing, restlessness, anxiety, and fear. Serious side effects are rare, but cardiac arrhythmias may follow administration of epinephrine. Conditions. This directive applies to any patient who has not received 2 dosages of epinephrine, either self-administered or by another person, within the last 30 minutes. If greater than 30 minutes since the last epinephrine and the symptoms remain, this directive may be repeated. Indications. Any patient who is not under the care of paramedics who demonstrates signs and symptoms of anaphylaxis, such as dyspnea, shortness of breath, respiratory distress, wheezing, airway stridor, generalized hives, facial or oral or tongue swelling, and is hypotensive, systolic blood pressure of less than 90, or if the patient demonstrates the signs and symptoms of an acute allergic reaction and signs of severe respiratory distress, such as wheezing, airway stridor, generalized hives, facial, oral, or tongue swelling, and severe abdominal pain, only if less than the age of 35, no cardiac history, and has a systolic blood pressure of less than 180. Procedures. Apply the LifePak 15 monitor. Check vital signs. Check level of responsiveness, airway breathing, circulation. Ensure airway patency if needed. Ensure the patient has an adequate respiratory rate and volume. Perform ventilation assistance with using the BVM if required. Administer oxygen via non-rebreather at 100%, 15 liters per minute. Inspect the epinephrine auto-injector for any damage or obvious exposure to freezing and verify the drug expiry date. Use only non-damaged, non-expired products. If any doubt, use a different device. Expose the bare skin of the thigh if practical. At a maximum, the auto-injector may penetrate 1 layer of thin clothing. Do not inject through outerwear or heavy fleece or wool material. Administer the epinephrine auto-injector into the thigh. For adults greater than 12 years of age, greater than 40 kilograms, administer 0.3 milligrams. For adults less than 40 kilograms, administer 0.15 milligrams. For children under 12, administer 0.15 milligrams.
To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds. 5, 4, 3, 2, 1. Injection complete.
If no significant improvement in the patient's condition occurs, the firefighter will administer a second epinephrine auto-injector, if available, within 5 minutes following the initial injection. Firefighters will not administer more than 2 epinephrine auto-injector devices to any patient. The firefighter will assist the patient to use their own bronchodilator for respiratory distress, if available and applicable. Any patient who receives epinephrine requires paramedic transport to a hospital. Monitor and document vital signs and the level of alertness within 5 minutes. The report to the paramedics should include the number of dosages of epinephrine, the vital signs, and the response to treatment. Upon returning to the fire station, complete the electronic MAR form and download the defib. Inform the patient or parent, guardian, next of kin of the treatment protocol and obtain consent if able. Inform patient and or guardian or parents or next of kin of expected response and possible adverse events. In addition to improvement of the allergic reaction, the patient may experience minor side effects such as palpitations, respiratory difficulty, pallor, dizziness, weakness, tremors, headaches, throbbing, restlessness, anxiety, and fear. Rare side effects may include cardiac arrhythmias.